Hello, and welcome to the Syneron Candela series of exclusive webinars created to help you grow your practice with the newest aesthetic technology. Tonight's webinar is entitled New Treatment Protocol for VelaShape 2 Stacking Mode. In this webinar, you'll be introduced to stacking mode, an exciting new treatment approach which will shorten the frequency requirement with better results. Our speaker tonight is Dr. Kanika Patel. Dr. Patel is board certified with expertise in aesthetic medicine, which she has practiced in the United States and Europe. Dr. Patel currently serves as the Global Director of Clinical Education for Syneron and Candela. If you have any questions, you can click on the Ask a Question button and send it to our team of experts. Also, please fill out the survey at the end of the program.
I'd like to welcome you to this webinar, which discusses the new treatment protocol for the stacking mode for VelaShape 2. This protocol offers the same results with 50% fewer treatments. It is a rapid protocol in the sense that the entire treatment protocol is only 3 treatments. There is 1 treatment every 2 weeks for a total of 4 weeks. If you begin the treatments on day 1, there will be a repeat treatment 2 weeks later, and the final treatment will be 4 weeks after the first treatment. That offers the patient the opportunity to have a complete treatment protocol session in just 1 month. The treatment sessions are approximately 45 minutes to 1 hour per large treatment area. A large treatment area would be one thigh, or the anterior part of the abdomen, or the posterior part of the abdomen. We recommend a maintenance program of 1 treatment every 8 to 12 weeks following the very last treatment in the initial protocol. The outcome has been very good. The thigh circumference reduction is an average of 1.5 to 2 centimeters per thigh. There can be improved measurements in some patients as well, but the outcomes are excellent, so they are the same or better results with 50% fewer treatments. The new technique does require a cover change, and that cover is going to be discussed a little bit later. The technique is the new stacking mode, and the applicator or cover that we're using will be on the large applicator, the V-Smooth applicator. The cover is the new stacking mode cover, and it is the cover that should be used now for circumferential reduction. In the cover, you will note that the rollers have been deactivated for stacking pulses. The example of that stacking mode cover, which we'll discuss a little bit further in detail later on in the webinar. The new disposable covers for the stacking mode are predominantly for circumferential reduction. You find that the massage rollers have been disabled. They are packaged with the new protocol quick reference guide, so that you are able to follow the protocol with a quick reference guide once you receive the covers. The current covers are for cellulite reduction predominantly, and those massage rollers are enabled, so you will be able to continue using those covers for cellulite reduction using the rollers, and they will be packaged with the current quick reference guide. There are benefits to the stacking protocol. The benefits, of course, are same or better results in half of the office visits, which is a great benefit for the patient. And we have optimal and reproducible outcomes in the clinical studies that have been done. So it's an excellent protocol because it works and it's very efficient. Nurses also have their benefits because when the patients are happy, there's increased patient compliance. There's certainly practice efficiency in that you can get the patient in and out in 50% fewer visits, patient satisfied, and therefore become your patients for a long period of time, and allows the practice to increase their revenue. To discuss the protocol in depth, I'd just like to show you some pictures. On the left, you see baseline, and on the right, you see an improvement 1 month after just the first treatment. The VelaShape 2 is indicated for the temporary reduction in the appearance of cellulite and the temporary reduction of the thigh circumference. That is a predominant indication for the stacking protocol. In addition, you will have a temporary improvement in the localized circulation. The treatment mechanism is, I think, very important to discuss. In the stacking protocol, the predominant mechanism is a combination of heat and vacuum. Know that vacuum potentiates neocollagenesis via the mechanical stress that is imposed on the dermal fibroblasts. So the fibroblast proliferation via stimulation of the stretch receptors. There's also, because of the vacuum, a targeted and deep penetration of the radiofrequency. And in addition, the vacuum via the negative suction pressure opens up the compressed blood vessels and improves the circulation. Now, the most important component of all of this, of course, is the heat. We know that we've got to deliver the adequate amount of heat, and in this case, we are able to deliver adequate levels of heat, and that promotes a positive thermal stress and a localized inflammatory response. This response stimulates metabolic activity in the adipose tissue, and adipose cells begin to behave in a less sluggish and much more metabolically active way. So the metabolic reactions in the fat cells are increased, and this is what we want for circumferential reduction. Also, what we have with an improvement or increase in a localized inflammatory response and increase in the temperatures in the dermis is stimulation of collagen and coagulation. So we actually are able to obtain protein denaturization because we're able to reach the adequate temperatures and maintain those temperatures over time, and in turn causes the collagen shrinkage we want to see in the subsequent collagen synthesis. Additionally, the deep heat in the blood vessels improves oxygen dissociation. As we see in this next table, heat further potentiates oxygen delivery to the adipocytes. What the table illustrates is that as water is heated, the oxygen that is dissolved in the water has less viscosity. It becomes far more ready to dissociate from the liquid that it is carried in, and in this case, oxygen is carried in the blood. This oxygen is now much more ready to diffuse into the surrounding tissues, and that includes the adipocytes. 50 degrees centigrade and beyond, which is what we reach in the tissue with the stacking protocol, have an important increase in oxygen delivery. It allows us to achieve predictable results. Our goal temperature on the surface of the skin is 45 degrees Celsius. It means that we're reaching much higher temperatures deeper into the tissue. The action of the stacking protocol allows the temperature to be maintained over time, and this is very important. The protocol, in turn, creates much more heat below the skin surface, and it sustains this heat in the tissue longer than the current method. This is supported by robust clinical investigations. There have been over 15 clinical studies with different treatment protocols on over 240 patients, and in over 230 thighs, there was a significant improvement. These patients were followed 3 months after their last treatment, and it was found uniformly to show the patients had a progressive reduction in the circumference of their thighs over time, and they additionally had improvement in skin laxity and skin texture, improvement in cellulite with no adverse events, no significant pain or discomfort, and a very high level of patient satisfaction. What I'd like to do at this point is explain to you how to go about implementing this protocol with the stacking covers. Again, this is the stacking mode cover. As you see, it is a different color, and it has stacking mode printed on the bottom, so there's no confusion. It does not require a different software upgrade. It will go right on the VelaShape 2. It's interchangeable with the current covers. You'll find on the other side that the rollers have been disabled, and it is important to use these covers with the stacking mode because you will get much better coupling with these covers. Because of this, the treatment is more comfortable for the patient, and as the rollers are not activated, lax tissue will not be moved up into the hot areas. This is much more comfortable and also much safer. So use stacking mode covers for the stacking mode protocol. The basics of the procedure are essentially the same. You'll follow the same rules of patient selection, the same indications and contraindications, and you'll prepare the skin and the patient in the same way as the previous protocols. What you'll do prior to beginning the treatment for this particular protocol is mark out the areas that you wish to treat. See here that the areas are being marked out, and this is actually a sub-area that I am holding up on the thigh of this patient. The thigh, for example, is marked into 3 areas, area A, B, and C. Now we're marking area A, which is the anterior outer portion of the thigh. That area is composed of 4 sub-areas, and I'm holding a sheet that covers one sub-area. The reason that this is important is that this protocol will be carried out using different stacking pulses on various parts of the sub-areas. So each treatment area is going to be divided into 4 sub-areas. If you have a smaller region, then you'll use just 2 sub-areas. These areas are 10 by 10 centimeters each. The entire area is 20 by 20 centimeters. In these sub-areas that are 10 by 10 centimeters, you'll see segments, which are 5 by 5 centimeters. And the reason that these segments are 5 by 5 centimeters is that the internal portion of the cover measures 5 by 5 centimeters. So the cover when it's placed on the segment, will heat that 5 by 5 centimeter region. As you can see here on this slide, this area is subdivided into the 4 segments, 1A, 2A, 3A, and 4A. This particular slide is a schematic of the thigh. You can see here that the thigh is divided up into 3 different areas, area A, B, and C. Area A in red is the anterior outer portion of the thigh. The area of the thigh is further divided up into 4 sub-areas. Sub-area 1A, sub-area 2A, 3A, and 4A. Each sub-area is further subdivided into 4 segments. Start by using the protocol on the anterior outer portion of the thigh, and we'll work through area A. But also note that the anterior inner portion of the thigh is area B, and then the posterior portion of the thigh is area C. So again, here we are marking out the sub-areas to be treated, and I'm marking out here area A, and out the sub-areas within area A on the anterior outer portion of the thigh. This is a sheet that you can use to place on the entire anterior outer portion of the thigh, and marks out on the thigh where you'll be pulsing. So this is an example of area A, anterior thigh outer region, and next to it I have the temperature probe, because we'll be relying on the temperature probe and the patient to tell us when we've reached endpoint. This slide shows the area A again, which is the anterior outer portion, divided into the 4 sub-areas, and these 4 sub-areas will be further divided into the segments, which is where we'll be pulsing. It shows a picture of area B, the anterior inner portion of the thigh, and the 4 sub-areas. You can see that area B has been further divided into sub-areas. And this is area C, which is the posterior thigh. It's been divided into 2 sub-areas, and each sub-area has been divided into 4 segments. Getting to the treatment protocol, you'll see now that if we're working with area A in red, which is the anterior outer portion of the thigh, we'll begin by treating in sub-area 1A. We'll go to segment 1 in sub-area 1A, and we'll stack 9 pulses in segment 1. Then stack 9 pulses in 2, 9 pulses in segment 3, and 9 pulses in segment 4 in a round. As completed 9 stacked pulses in each segment, we will stack 8 pulses in each segment, then 7, then 6, then 5. Once we reach 5 stacked pulses in each segment, we will continue with 5 stacked pulses in each segment until we reach temperature endpoint, which is 45 degrees centigrade, or the patient tells us that the heat is sufficient. Once we're able to complete the 9 to 5 portion of the protocol in 1A, we'll move to sub-area 2A, and we'll work each segment the same way, pulsing 9 stacked pulses in each segment to 5. Continue to rotate, stacking 5 pulses until we reach 45 degrees centigrade, or until the patient is able to tolerate no more heat. Once area 2A is complete, we will move back to area 1A, and we'll begin the 8 to 4 portion of the protocol, where we will begin stacking with 8 pulses, then 7, then 6, then 5, then 4. At this point, we'll continue to stack 4 pulses in a round until we reach endpoint or patient tolerance. And once that happens, we'll go to area 2A and do the 8 to 4 portion of the protocol on 2A. Now we've completed 9 to 5 and 8 to 4 in 1A and 2A, we move on to 3A and 4A within area A, and we will do the same exact thing. Once those 2 sub-areas have been completed, we'll move to area B. So here you can see that this is area A in red. This is the sheet that was used to lay onto the patient's anterior outer portion of the thigh and mark out the sub-areas and segments. Now see how we'll stack, but what do we do with the settings? We are working, of course, to improve circumferential reduction. The most important parameter is the radio frequency. Recommend that you start the radio frequency at a level 3 and keep it at a level 3 if at all possible. If necessary to turn down to a level 2, that's fine. The important thing is to be able to continue with the stacking with the radio frequency on. Radio frequency, of course, if the patient feels discomfort, start at level 3 and then move back to this next 3. The vacuum is set at level 1. May increase this vacuum according to the patient's tolerance. Do not increase it above 1 on loose skin areas. The R is off. These next slides demonstrate the treatment protocol in action. The first slide shows that we have marked out the areas, and we're beginning in Area A, Subarea 1A, in all 4 segments, 9 to 5. Here is a short demonstration of how the stacking occurs. 9 pulses, then 8, 7, and so on. 5 pulses per segment are reached. Temperature can be measured. If the patient doesn't feel warm yet, you can continue with 5 pulses per segment until you reach temperature endpoint. Temperature endpoint should be 45 degrees or as close to 45 degrees as possible. Of course, you must be in tune to patient tolerance, and if the patient can no longer tolerate the heat, then you may need to move to the next sub-area. As you see in this slide, the 9 to 5 section of the protocol has been completed in sub-area 1A. Temperature has been checked, and are continuing to move in around, pulsing with 5 stacks in each segment of sub-area 1A. There erythema, which is normal, and there is warmth. Once the temperature endpoint was reached here in this patient, we moved on to sub-area 2. We move to sub-area 2A and are pulsing in the 9 to 5 portion of the protocol in sub-area 2A. And in the next segment, we move back to sub-area 1A and pulse 8 to 4. We have now completed sub-area 1A with 8 to 4. We have reached treatment endpoint in that sub-area. And now we'll move to sub-area 2A, pulsing 8 to 4 until we reach treatment endpoint in sub-area 2A. We complete these 2 sub-areas, 1A and 2A, within area A, we will go up to sub-areas 3A and 4A. We will follow the same steps. We'll pulse 9 to 5 and reach endpoint, and we'll pulse 8 to 4 and reach endpoint, and then we will continue the same exact procedure in area B, which will then be the anterior inner portion of the thigh. Once this procedure is fully completed in area B, we will turn the patient around and treat area C. After we've completed area C, we will repeat the entire procedure in area A, then B, then C, before moving to the other thigh. Again, the treatment endpoint is skin surface temperature measurements of 45 degrees centigrade. The closer you get to 45 degrees centigrade, the better your results. So 45 degrees centigrade is your goal. Now, if the patient cannot tolerate further heat, then you'll need to stop. The protocol, again, is 3 treatments within 2-week intervals. And again, we do have a maintenance treatment recommendation, which is 1 treatment every 8 to 12 weeks from the last treatment. You find with these stacking covers that the protocol is really very easy and well tolerated. Do use the marking, especially with the initial patients, as it will help you understand where you want to treat and how much room you need to leave. As you move along, you may not need to mark out the patient in quite such a specific manner. We hope you enjoy using this protocol. We think you will find that it is very easy to use and yields the same or better results in your sessions. Thank you very much for joining us.
Thank you, Dr. Patel. Here are some questions for you. First question, what is the stacking mode?
The stacking mode is a new protocol that allows us to reach deep into the tissues and maintain temperature for a longer period of time. We're able to reach high temperatures and keep those temperatures up over a longer period of time, which is ultimately what's important to track the changes that we want to on the adipose cells and also on the skin texture and laxity.
What are the benefits of the stacking protocol?
The stacking protocol is easy to use. It's comfortable for the patients. Patients come for 3 treatment sessions as opposed to 6 or 8 treatment sessions. So fewer visits to the clinic for the patient. And the results are the same or better.
Explain how long a typical treatment might take.
Length depends on the size of the area that you're going to be treating. It's very important with the stacking protocol or with any Vela protocol that you do treat the entire area. We find that the results are much better treating the entire area. And so we recommend that a large area is treated for a minimum of 45 minutes. One thigh can take approximately 45 minutes to an hour, and the opposite thigh will, of course, take the same. Some patients will be a little bit less because of the size of the patient and also because of the rapidity in which they reach treatment endpoint. It may take a little bit longer.
Are there any protocols for patients post-treatment?
We don't have any specific protocols that the patient needs to follow post-treatment. We do have a lot of practitioners who recommend that the patient remain somewhat active. Taking walks is always a good thing that improves lymphatic drainage, but we don't have anything specific. The only thing that we ask is that the patient maintain their diet. We don't recommend that you go out and have a cheese pizza after the treatment. But apart from that, all of our clinical investigations have shown improved circumferential reduction in patients who have maintained their same weight, so that there's no weight loss. We don't ask the patient to do anything special in particular.
Dr. Patel, is there any collateral material that I can get from Cineron?
To help you understand the stacking protocol, we have, of course, this webinar, but the collateral material are the quick reference guides that are included in with the covers, and also on the websites there is more information regarding the protocol and regarding VelaShape 2 in general.
Thank you, Dr. Patel. That concludes our webinar. To download other materials related to our topic, please go to cineron-candela.com. Thank you.